Okay, so when you get a cut or a scrape, what do? You probably just grab whatever bandage is in the cabinet, right? Well, what if I told you that not all bandages are created equal? In fact, picking the wrong one could actually be getting in the way of your healing. So let's take a closer look at what makes the right bandage so different.
I mean, think about it. Have you ever wrapped a wound and then a little while later it's throbbing? Or taken a bandage off and the skin underneath is all white and soggy? Yeah, those are really common mistakes. But that kind of thing can actually constrict blood flow and create the perfect damp environment for an infection. It can turn a simple covering into a real problem.
And this is exactly where the surgical bandage, or Bandage Cloth BP, comes into the picture. It's totally engineered to avoid those common issues. It's designed with a completely different mindset, focusing on what a healing injury actually needs to get better.
So, what's the first big difference? Well, it's all about what this bandage is not made of. Let's dive into why its lack of elasticity is actually its greatest strength. When we say non-elastic, we mean it. There are literally zero elastic fibers in it. So unlike that typical stretchy bandage that snaps back and squeezes, this material just stays put. It doesn't tighten up. This means it can hold a dressing in place without ever putting that nasty, unwanted pressure on the sensitive tissue underneath.
And this quote right here, it just nails it. This isn't some happy accident. It's the whole point of the design. Its main job is to hold things in place, but to do it gently. By completely avoiding constriction, it makes sure that vital blood flow is never cut off, which is absolutely crucial for proper healing.
All right, the second game-changing feature is all about airflow. Here's a simple fact. A wound that can't breathe is a wound that can't heal right. Let's check out how this bandage totally solves that problem.
The secret's right there in the design itself. The material has what's called a loose weave. This special construction creates all these little passages that let air move around freely over the wound, so it keeps it protected, but it still lets it breathe.
And this comparison just lays it all out, doesn't it? On the left, a standard bandage can trap moisture and heat, which slows down healing and is basically a welcome mat for bacteria. But on the right, with that loose weave, air is circulating, keeping the area dry, and creating the best possible environment for your body to do its thing.
So knowing all this is great, but how do you actually use it? Because this is a specialized tool. It's really designed for very specific jobs. Let's go over its main uses.
It really shines at three main tasks. First, retaining dressings. Its #1 job is to keep gauze or other wound coverings right where they need to be. Second, fixating devices. Think about things like catheters or medical monitors that have to be held on the skin without being squeezed. And third, just providing a simple, protective layer that shields a wound from bumps and dirt, all without adding any harmful pressure.
Okay, now this part is super important. Like with any medical product, using it the right way is directly tied to safety. There are a couple of critical warnings we absolutely need to cover, just to make sure you're using this tool correctly and, more importantly, safely.
And listen up, because these are non-negotiable. First, you never use this bandage around the neck, for any reason, ever. Second, it is not designed to stabilize compound fractures. Those are extremely serious injuries that need specialized medical help. These aren't just suggestions, they are critical safety rules. So let's just pull it all together here. This table gives us that perfect side-by-side look. The surgical bandage, non-elastic, zero constriction, and super breathable. Your typical elastic bandage? Well, it's made to apply pressure, and it often traps moisture. It's pretty clear, right? They're just fundamentally different tools built for completely different jobs. So the next time you reach for a bandage, just pause for a second and ask yourself this. Are you actually choosing the right tool for healing? Understanding the huge difference between just covering something up and actively helping it can have a massive impact on how well and how fast you recover. So you got to ask yourself, are you just covering a wound, or are you truly helping it heal?